Welcome to the news on Lagos Television. I am Bababumi Agbibi. The national grid collapsed on Monday, plunging millions of Nigerians into darkness. Electricity distribution companies across the country said the grid collapsed around 6:48 p.m., resulting in the loss of power supply across their networks. Eco Electricity Distribution Company, EKEDC, which serves some parts of Lagos State, revealed this on its X handle. The Enugu Electricity Distribution Company also told its customers about the general system collapse, which has affected customers in Abia, Anambra, Ebonyi, Enugu, and Imo states. It was also a similar situation with the Kaduna Electricity Distribution Company and the Abuja Disco, which promised the restoration of normalcy as soon as possible. Recall that this is the sixth time the national power grid will collapse. It collapsed on February 4, March 28, April 15, July 6, and on August 5, all in 2024. The Transmission Company of Nigeria, TCN, is, however, yet to comment on the latest national grid collapse. But in April, the Executive Director of the Independent System Operator ISO Department of the TCN, Nafisat Ali, gave various reasons for the incessant grid collapse in Nigeria, which include inadequacy of gas supply, improper coordination of plants and gas pipelines, poor generation availability, among other issues. The Nigerian National Petroleum Company Limited, NNPCL, has agreed to sell petrol to members of the Independent Petroleum Marketers Association of Nigeria at 995 naira per litre, following the intervention of the Department of State Services in the controversy between the two parties. The National Vice Chairman of IPMAN, Ahmed Fashola, confirmed that through intervention, the Nigerian Midstream and Downstream Petroleum Regulatory Authority agreed to pay the association's outstanding 10 billion naira. He assured that IPMAN members would no longer sell at prices much higher than that of major marketers, adding that the difference in price is the reason for the queues in some filling stations in the cities. IPMAN had revealed that the cost of petrol from the Dangote Petroleum Refinery to NNPCL was about 898 naira per litre, but noted that NNPCL was selling the same product to independent marketers at 1,010 naira per litre in Lagos. The association, which controls over 70% of filling stations nationwide, kicked against this and threatened to down tools, as it also demanded a refund from NNPC from earlier petrol supply payments made by its members. The Vice President, Senator Kashim Shettima, has inaugurated the steering committee of the Nigerian Jubilee Program, NJFP, as part of measures by the federal government to scale up its employment initiative and enhance the employability of fresh graduates with market-ready skills and competence. NJFP, a Nigerian government initiative being implemented by the United Nations Development Programme with a seed investment from the European Union, is coordinated by the Office of the Vice President. Speaking while inaugurating the steering committee of the NJFP at the Presidential Villa, Vice President Shettima described the program as a decisive step by the administration of President Bola Ahmed Tinubu towards equipping Nigerian youths with the required tools to become employees, innovators, and leaders in their chosen careers. Earlier in the remarks, the UNDP resident representative in Nigeria, Elsie Atafua, commended the federal government for its unwavering leadership and commitment to advancing Nigerian human capital development, particularly youth development, as part of the Renewed Hope agenda. The Speaker of the House of Representatives, Tajuddin Abbas, has called for the implementation of the Discrimination Against Persons with Disabilities Prohibition Act 2018 by ministries, departments, and agencies who have refused to align with the implementation of the act. Abbas made the call during a public hearing over the non-implementation of the Act by MDAs and other public buildings organized by the House Committee on Disability Matters. The House Speaker, who spoke through the House Majority Leader, complained that not up to 5% of the Persons with Disabilities Prohibition Act is implemented, and that when the Act undergoes amendment, 1 year sentence will be enforced for non-compliance. Chairman of the House of Representatives Committee on Disability Matters, Bashiru Dawuda, said the inquiry will look into ensuring that PWDs have access to employment in MDAs, inclusion in politics, access to public buildings, and inclusion of sign language in media houses. Executive Secretary, National Commission of Persons with Disabilities, Ayuba Gufun, noted that about 35.5 million PWDs are in the country, and there have been very low compliance by MDAs regarding infrastructure and facilities for this group of people. Recall that on February 24, 2024, the House resolved to probe the non-compliance of the PWD 2018 Act by MDAs following a motion raised during plenary. Over 100 military personnel have benefited from free cancer screening and testing organized by medical students of University of Lagos. The free medical service held at the Murder Barracks in Yaba, Lagos is tagged Even Heroes Need Saving, and it is aimed at ensuring the well-being of the officers.
You will see that there's a difference between physical being and mental well-being. These two things come together to give us what we call our overall wellness. So today we have been able to focus all together on prostate health. So today we had free prostate cancer screenings for over 100 men of the military that's of the armed forces here today. We'll also be able to have mental health assessment provided by our partners from the Federal Neuropsychiatric Hospital Yaba. We're able to have free mental health assessment for every single man here in the barracks today and their families and their wives, because we see different statistics that show the variety and the degree of impact when our heroes, go out there to save lives and defend the country, to defend the nation.
Military officers, including the family, also benefited from the medical mission.
We are screening them on PSA, that is prostate-specific antigen test. Then we check their blood sugar as well their BP, just to know the wellness, then for them to know their status. So far, so good. We are able to cover which number of numbers here in the barracks, together with their wives and their children.
We usually go to places to do this kind of screening because we want to create an awareness. Most people are actually living with cancer, but they don't know they are actually living with cancer. So whenever you have been detected positively, then you are going to be referred to a cancer center.
Individuals and organizations were urged to complement efforts in giving back to the society as Nigerians were advised to imbibe the culture of regular medical check. The Nigeria Center for Disease Control and Prevention says Mpox has spread to 63 local government areas in the country across 25 states and the Federal Capital Territory. According to the reports, 94 confirmed cases have been reported out of the 1,297 suspected cases recorded so far from January 1 to October 6, 2024. NCDC noted that 47 new suspected cases were reported in week 40 of 2024, compared with 67 cases reported in week 39. It's however noted that 6 confirmed cases were reported in week 40, compared with 10 confirmed cases reported in week 39 of 2024. Non-polio supplemental immunization activities will commence from October 19 to November 2, 2024 across Lagos State. Non-Permanent Secretary, Primary Healthcare Board, Dr. Abimbola Bowale, says the exercise will provide vaccinations for children from 9 months. Health correspondent Amina Telegushi tells us more.
The Lagos State government, in collaboration with UNICEF, organized this one-day orientation for journalists in Lagos to equip them with knowledge needed to adequately disseminate information about non-polio supplemental immunization activities.
This is not a new vaccine. This is a vaccine that has been used for decades, and its safety and efficacy is proven. A single dose of this vaccine confers a lifetime protection, and you're expected that within 14 days of taking this vaccine, you will develop antibodies for it. It's expected that when there's an outbreak, a booster dose of the vaccine would be given, and that is what we are doing as a state, to give everyone a booster dose. We're also encouraged to keep our vaccination cards, because this is an evidence that we have been vaccinated. Adverse events that may happen after getting the vaccine could include mild headaches, muscle pain, and very low-grade fevers.
Permanent Secretary, Primary Healthcare Board, Dr. Abimbola Bawale, who led other permanent secretaries of the 6 health districts, says the target is to administer vaccination for children from 9 months.
Yellow fever from 9 months to 44 years. So adults are also eligible for yellow fever vaccine. We also have measles from 9 months to 18 months. And so that is basically for our children. And then, of course, we have HPV vaccine that covers from 9 years to 14 years. So for the other routine immunizations, they also continue to go on, like oral polio and the rest. Immunization process itself commences on the 19th of October 2024, and it's going to be initially for the first 2 weeks.
While highlighting types of vaccines that will be administered, Dr. Bawale says the aim is to ensure health immunity.
This immunization will be available virtually everywhere. It will be available in all our PHCs. We'll take it to where we know that people are going to congregate. We'll take it to churches. We'll take it to mosques. We'll take it to motor parks. We'll take it to schools. And then there's also a group that will move from house to house, from street to street, to ensure that everybody is covered with this vaccination. So we are thinking of covering at least 18 million of the population of Lagos State. Is it with the vaccine? Yes. All vaccines that are going to be given during this exercise and all vaccines in our PHCs are always free.
Parents and guardians are advised to participate in the exercise to ensure a healthy Lagos. Aminat Elegushi, LTV News.
For more news, connect with Lagos Television on these social media platforms. Please remember to call Lagos toll-free lines 767 or 112 in case of emergencies. Many thanks for watching. I am Bababumi Agbibi.